So I have an order for a trach sectioning. I have gathered my supplies and I'm going into the room. Hello, my name is Yesla and I'm going to be your nurse today. I have an order for a trach sectioning. Could I have your full name and date of birth?
Melissa Diaz, 7/15/93.
Thank you. And then do you have any allergies, Ms. Diaz?
No.
Okay, so that does match my order. And then I'm going to go ahead and lift the side of the bed to get you comfortable. And I'm going to start your respirations, okay?
Okay.
So can you go ahead and cough for me to loosen up some of those secretions? Okay, thank you. So I do see that there is some fluid in there, some secretion fluid. I'm going to go ahead and hyperoxygenate you. I'm going to turn on the trach section. I'm going to put the tubing right next to you. And then I'm going to gather my supplies and get started, okay?
Okay.
So I would. Pocket. I'm gonna now open the gloves. Now I'm gonna go ahead and
the nurses that have
open this
assigned
and dump it
we've got a few nurses that they've been
on top.
they're really
Then I would open the sterile water.
and they're all fun. They're all so fun. Like every now and then a bunch of us gather around and start telling stories and
I'm going to go ahead and don my gloves on.
but I need to. What for Monday? I wanted to get it done today. I don't know. How do we Okay, I'm just gonna do it real fast.
Now that my gloves are on, I'm going to go ahead and rearrange my equipment. I'm going to dispose of this.
I'll go to like a whorehouse. I'll go to not a whorehouse. That's not good.
Okay. Now I'm going to open up the tubing and dump that. This will be in my sterile hand. So then I'm going to go ahead and, this hand is no longer sterile, apply the suctioning. And then I would test the suctioning, 2 to 3 inches. Okay, so it is working. Then I would go ahead and remove the oxygen. And then I'm going to go in 6 to 8 inches. Okay, so now pulling out, I'm going to go ahead and suction for 10 to 15 seconds, no longer than 15. Okay. And how do you feel, Miss Diaz?
Good.
Good? All right, I'm going to reassess your lungs.
Okay.
And I would check respiration, and then I would check his oxygen level, and then if she needed to be resectioned, I would go ahead and clean it in the sterile water. I give him time to get his respiration back to normal, and then I would resuction. Since he doesn't need to do that, I would go ahead and remove the suctioning. My assistant would turn off the suctioning, And then I would go ahead and remove the tubing. And then remove my gloves. Then I'm going to go ahead and perform hand hygiene, get a new set of gloves. How you doing, Miss Diaz?
Good.
Okay. So now I'm going to remove the cannula.
I need to still try to do the video today. Oh, yeah. Thank you. Yeah.
Then I would go ahead and insert in the sterile water, remove my gloves,
Do you,
and then I would go ahead and don my gloves.
or you have yours actually? Yeah, I'm just gonna.
I'm glad you feel good about it.
Okay, now that I have my gloves on, I'm going to go ahead and get the cleaner. And then this hand will no longer be sterile.
Oh yeah, like I'm not.
So I would
gonna
clean
keep it like this.
outside,
Unless you want me to move somewhere, I'll try to like. Or do you want this to stay
inside,
here, like later? Yeah.
and then I would dispose of the cleaner, and then rinse it in the sterile water, and then I would reapply.
So whenever you like press this, you just press that, and then this to pause the video and this to stop the video.
Okay, so it's click, and then I would reapply oxygen,
Okay.
and then I would remove the dressing that would be in place. That would normally stay on there. And then I'm going to go ahead and grab this dressing to clean. I will fold it, add water,
And then let me know.
and then clean around the trach area for any dry secretions. Okay. And then I would dispose of this, and then I would grab
Feeling okay.
Q-tip, put it in the sterile water, clean around the
Yeah,
stoma,
this is Diaz, November 19th, 1998.
Okay, and do you have any allergies, Mr. Diaz?
No.
and then now I'm going to go ahead and grab the new tie, dispose of that.
So I hear that from
So I'm going to lift your head a little bit, okay?
Okay.
you do some congested.
Oh, just give me one moment. Sorry about that. It just keeps getting stuck to your
I'm still feeling something in there.
Okay, alright, I'll help you. So I'm turning over section. Continuous. And then I'm ready to start the procedure.
One more moment, Miss Diaz. I'm almost done. Okay. So I would make sure that there's 2 inches, and then I'm going to remove the old trach ties. Okay, so I would dispose of I'm gonna lift your head. I would dispose of the old treat cars. And then I'm just gonna perform one more respiratory assessment on you.
Okay.
Yeah, I just paused.
Okay.
Yeah, so all you just need to do is
Thank you so much. Okay. So your lung sounds better. I would also check your pulse, your oxygenation rate, just to make sure you get to normal levels, and then I would go ahead and put your oxygen back to normal. And then I would document the procedure, how you tolerated, the amount of secretions taken out, the consistency, and the color. And then if you need any more help or any more questions, just please feel free to let me know. Normally this would stay on, the oxygen would stay on. And then I would remove my gloves, or actually, before removing my gloves, I would go ahead and place the new pad on here. And then once the new one's in, then I would go ahead and bring the oxygenation lower, check the respiratory, the pulse, the oxygen, document, and then before documenting, remove my gloves, clean the area, perform hand hygiene, and then I would go ahead and document. Okay?